Hi, I'm Dr. Robert Lowe, Medical Director here at Columbus Fire. Thanks for joining us today. We are actually working on a drill practice, if you will, for a mass casualty event.
Am I dead? I didn't actually.
No, you're breathing once every second, so you're kind of heavily breathing.
Right.
Once every 6 seconds is
But I
normal.
can't-
One every second.
Oh, okay.
One every
Yeah.
second. You're not responding to their question.
Don't hyperventilate though.
Columbus Fire staffs a lot of special events, but with that we always have that concern about should something escalate, should something turn into a lot of injuries. And today we're partnering with Ohio Health, Sports Medicine, Ohio Health, Emergency Medicine, to just go through policies and procedures and practice doing a couple of scenarios with a marathon.
All right.
All right.
Nice. Can you introduce yourself? Who are you?
Yeah, I'm Gage Goki. I'm a first-year emergency med resident at Doctors.
So today's scenarios, we're actually going to try two different scenarios. So one is going to be a vehicle into a crowd. Obviously with that you get a lot of blunt injuries, concerns for different degrees of injuries from very critically injured to minor injuries. And the second scenario will be an explosion scenario. You may recognize that both of these have occurred in real life, and so it's an opportunity for us to practice and to hone on the lessons learned from other events.
If you're injured and you can walk, come over here. If you can't walk, raise your hand. If you can't walk, raise your hand. If you're injured but can walk, come over to the grass. Come this way. Walk toward us if you can walk. If not, raise your hand. Yell in the red, yell in the yellow.
SALT triage. So SALT is the program we're using as a region now. That's a recent transition over the last couple of years. Hopefully you all seen that stuff. It's a pretty simple program. The idea is that you sort patients, you assess patients, you treat life threats, and you move on. So typically that sorting is a voice command of if you can hear me, you move. All those folks who didn't move, then you ask them if they're injured or need help to raise their hand. The weird part of that is whoever didn't raise their hand is the person you go to first, right? That's the most critically concerning patient because of what's happened to them. And the idea is that in 15 to 30 seconds, you should be sorting these folks out of if they're immediate or what we call red, the delayed yellow, the green, any of that. In SALT, there's a different category than we used to use, and that's a gray and expectant, so not dead yet, but an expectant. And you'll see a little bit of that, but we'll work through all of that on the scenarios today. So.
Once every 4 seconds, so they
I can't move.
can't move.
My back hurts.
Responding?
Yeah.
Back hurts?
My back hurts.
Okay.
I can't move my legs.
Okay. Other than that,
My
just
kid
kind of musculoskeletal
okay?
stuff.
He doesn't move.
Yellow. You say that right now. How's he doing? Black. I'm not sure.
What does black mean?
Once
Are
in a
you
second.
gonna help
Left
us?
chest rising. Yeah, that's a gray, right? Unresponsive. Yeah. There you go.
Yes.
You gonna help us?
Got triage bands if you need.
How's it go? Can you help her?
We're looking at it very holistically. So the setup is we're going to have one scenario. We're going to go through taking care of those injured. We're going to take a pause shortly thereafter. These are only going to be 10 or 12 minutes because the first 10 minutes of any event is the most important. And then we're going to come back in here. We're going to debrief that. What worked, what didn't, what should we do differently, and then we get to do it all over again. So a different group gets to participate, you get the chance to look at some new and different things each time, a little bit different injury pattern, things like that, and we'll debrief it one last time and then talk about ways that we can continue doing some of this stuff, what are other ways that we should be utilizing some of these things, and then hear from some of these experts that do this every day. So what does Columbus Fire expect if we're on scene and something happens, whether it's a multi-victim mass casualty, what might transpire. So the goal for the day is not going to be around any individual performances. It's just around the teamwork, the communication, the crisis resource management.
One red and one looks, I think, yellow. We got to move this red. We got to get the red over here to the other red.
Okay, 40, you have a fire.
Put the reds on with this area right over here, though.
I hurt my ankle. I don't really remember. It just
All right, we're gonna have you go with these guys right here, back to the medical van. Going back all that way.
So today we have Ohio Health participating with us, but within Ohio Health, it's the simulation group, it's the emergency medicine residency out of Doctors Hospital, and it's the family medicine, sports medicine group out of Dublin Hospital.
What do you got?
only left chest rising. Unresponsive.
Doctor?
No.
You got red. I don't know where they're actually going. Doctor? Yeah. I don't know. Are they
All of those groups are groups we work with at different times through training, through staffing, special events, and things like that, and just an opportunity to get together. In addition, we'll have Columbus Police here participating, we'll have Homeland Security, and other partners that Columbus Fire works regularly with. Some paramedics, some supervisors will be doing kind of dual roles, acting as though this were a special event staff, but also a number of our supervisors, our assistant medical directors and such, working as evaluators, just to build on our system and sort of learn lessons each time we do this.